Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So if you come across a patient with solitary thyroid nodule, then what do? So if the patient has solitary thyroid nodule, so there is a thyroid nodule is present. Okay, so first you will do physical examination and you will take the history and also you will examine the patient. Okay, you will take the history and then examine the patient, and then after that you will do a serum TSH, that is thyroid stimulating hormone. If this serum TSH is found to be low, or it can be normal. Okay, first if the serum TSH is low, then you do a radioactive iodine scan. On radioactive iodine scan you can find either a hot nodule or you can find a cold nodule. Now, if you have found a hot nodule, then in such cases you can do either iodine 131, that is iodine ablation can be done, or you can also do a surgery in case of hot nodule. Now, if there is a cold nodule, so if there is a cold nodule, then you should do ultrasonography. Even if it is a normal case, you should do ultrasonography. Now, after ultrasonography, now you have done an ultrasonography. Ultrasonography is done if it is a cold nodule, or in normal TSH levels. If there is a thyroid nodule, then you do ultrasonography. Now on ultrasonography, you will see two things: the size of the lesion. If the lesion is less than 1 centimeter size, then nothing is to be done. It is just to be follow up should be done if the lesion is less than 1 centimeters. Now if the lesion is more than 1 centimeter, or if the lesion is suspicious, if the lesion is either more than 1 centimeter or suspicious, then you should see whether the lesion is a cyst or whether it is a solid lesion. Okay, first we will see if the lesion is cyst. Now if the lesion is a cyst, after doing ultrasonography, and if the size is more than 1 centimeter, if you think it is a cyst, now if it is a cyst, first you will have to aspirate the cyst and then you will send for histopathological examination. And on histopathological examination you will get three results. One, either the cyst can be malignant or it can be a residual cyst. In both these cases, either it is a malignant cyst or it is a residual cyst, we will have, in both these conditions, it is advised to do a surgery. Now, if it is a benign cyst, the cyst can also be a benign cyst. In benign cyst, we can do follow-up can be done, and if even after follow up you have already aspirated it, so there is no problem. But even after follow up, if you see the recurrence of the cyst again, then you should either re-aspirate the cyst or you can do a surgery at this stage. Now second is if the cyst has normal TSH or it is a cold nodule, and on doing ultrasonography you have found out it to be more than 1 centimeter or suspicious, but it is a solid lesion. Now if it is a solid lesion, if you have found it to be a solid lesion, then now you have two things. Okay, if you have seen a solid lesion, then you should do an FNAC. Now, if the FNAC is malignant, if the FNAC says that it is a malignant tumor, or if it says that it has suspected malignancy, it is a suspected malignant tumor, okay, or if FNAC says that it is an indeterminate tumor, which is especially if it is an indeterminate Hurthal tumor, okay, in all these three cases we have to do surgery. Okay, if the FNAC shows that this is a indeterminate follicular carcinoma, you're not able to say whether it is a follicular adenoma or follicular carcinoma, so it is an indeterminate follicular tumor, then you will do an iodine 123 scan. In iodine 123 scan, you can get either a cold nodule or hot nodule. If it is a cold nodule, then it is 15 to 20% malignant, so we do surgery. Now, if it is a cold nodule, then we can just do follow up. Now, if in the FNAC, if it is shown as a benign lesion, now in FNAC, if it is a benign lesion, you directly do follow up in this case. So this is what you do in a solitary nodule of thyroid.
Thank you and thank you for watching.